Hi, my name is Alyssa Koval, and I did my system paper topic on the implementation of an electronic health record system in a cardiology practice. My system paper topic details are that it was a fictional scenario, and I based it in the spring of 2011 because that was the time when the meaningful use rule was coming out, and practices had to abide by these rules in order to get the incentive by 2012. So I thought that having the fictional scenario during that time, I would be able to kind of bring in the Medicare information, HIPAA information, and the high-tech information. What I used for a practice was just a small privately owned cardiology practice looking to upgrade to a certified electronic health record. The practice consists of 3 physicians, 1 physician assistant, 2 registered nurses, 1 medical assistant, and 2 administrative assistants. For this implementation, I utilized the ADDIE model. The ADDIE model is an instructional design methodology which offers a stepwise framework for the building and assessing of a project or design. There are 5 stages, which are analyze, design, develop, implement, and evaluate. Within the analyze phase, the problem is identified and the existing knowledge and skills are identified. So within my scenario, the current EHR is not in compliance with the CMS meaningful use requirements. There's a lack of interoperability between lab and other facilities. Orders are still being processed in paper form and patient communication difficulties. The importance of input from all varying clinical administrative roles to ensure the best use of the new EHR are very important during the analysis phase. The next phase is the design phase. This is when the objectives for the implementation are clearly outlined. The assessments and instructions are put into place, and then the planning and selection is completed. So this is done utilizing an implementation team, and they create a project plan. And with that project plan, they look at vendors and they ultimately decide to go with Epic Systems. And then after they decide who they're going to pick for a vendor, they analyze the current workflows and business processes. So my implementation team that I compiled was the head cardiologist, who is the owner of the practice. So she takes on a dual role of a project manager and a business manager. The registered nurse and medical assistant, so they would be responsible for the needs from the clinical support staff standpoint. And then the administrative assistant would help with kind of the business process, the scheduling, and the administrative side of the EHR. And then the small cardiology office ended up hiring an information technology specialist. They contracted them out because they're a small business and didn't have one already established. And then, as I said before, the EHR vendor that they decided to go with was the Epic system. During the development phase, the content is collected in the design. The content that was collected in the design phase is developed and actually integrated into the implementation plan. And this is when the prototype of the electronic health record is developed. And this is when the IT personnel comes in and works with the vendor to kind of make the whole infrastructure. Any fixes in the prototype should be resolved within this step prior to the implementation phase. And then during this time, staff training starts, and I decided in my scenario to utilize super users, so basically train the trainer method. And then also system downtime procedures are created, and the staff is also trained on this. At this point, the go live date is set, and this is the date that the EHR would be implemented. Next is the implementation phase. So this is the go live date arrives and the new EHR is implemented into the practice. On this day, the head cardiologist ensures that there's extra staff, a light patient load, and then the Epic vendor staff are on site for support of the transition. And then within the implementation phase, you want to make sure that there was continual training for staff who may need it post go live to ensure that their workflows are happening correctly. The last phase of the ADDIE model is the evaluation phase. And there's two different evaluations. One is formative evaluation, which happens within each step of the ADDIE model. So constant evaluation of your plan, making sure that each step is happening smoothly before moving on to the next one. And then the summative evaluation, which occurs after the implementation phase. And you're receiving feedback mostly from the users of the plan that was implemented. At this phase, you would identify any unresolved vendor issues, interface issues, and staff training needs. So these needs and issues within the practice will force changes within the electronic health record. And this would mainly fall under the IT personnel's responsibility with working with the vendor. So the value added of implementing a certified EHR in the small cardiology practice would be to improve quality and convenience of care, increase patient participation in their care, improve accuracy of diagnosis and outcomes, improve care coordination, increase practice efficiencies and cost saving, and then they would also be meaningful use compliant through the Centers of Medicare. These are the references that I used, and I hope you enjoyed my presentation.